Welcome to Logical Ayurveda. Today we are going to see a disease called leukorrhea. Leukorrhea, or in common term white discharge, is also called as Shvetapradara in Ayurveda. There are some diseases in which public expects Ayurveda doctors to do wonders. For example, skin diseases, gouty arthritis, and migraine, sinusitis, jaundice, etc. People expect Ayurveda doctors to do miracle in this because they have very good history of such diseases getting treated by Ayurvedic doctors. So this is not a rumor. This is a very true thing that people expect these diseases to be treated miraculously by an Ayurvedic doctor. Leukorrhea or white discharge is also one such disease where we can miraculously treat, provided we know the conditions associated with it and the particular type of dosha involved and the exact medicines to be prescribed to the patient. Before going into leukorrhea into detail, I want you to do an imagination, a vivid imagination that two patients are coming to your clinic. Patient number A and patient number B. Patient number A comes with a set of symptoms and patient number B also comes with a set of symptoms, and I want you to think, what medicine will you choose for both patients? Will you choose the same medicine for both patients, or will you choose different medicines for different patients? If different, what? Patient number A walks inside your clinic. When she walks inside your clinic only, you're seeing that she is very lean built or moderately built, whatever. The build is very less, either lean or moderate. You see that the skin of the patient is very dry. On examination, dragging the lower eyelid, you see that the patient is pale. It's not the patient does not look healthy. She looks anemic. And you ask the chief complaints of the patient. She complains, "Sir, I have white discharge." You ask, "What kind of white discharge do you have?" "Sir, I have thin and watery type of white discharge." Then you ask, "What are the associated complaints with it?" She tells, "Sir, I have giddiness. When my menstrual cycle is always associated with pain." We ask the amount of the bleeding that happens during the menstrual cycle. She tells that earlier it used to be more, like 10 or 12 days I used to have chronic bleeding that does not stop. Nowadays it is very, very scanty, and my weight has reduced since last year, since our last 6 months, etc. And I have hair fall, I have palpitation, I have repeated headache, I don't feel so much hungry, I always feel weak and tired. This is patient number 1. Patient number 1 tells, "I have white discharge which is thin, white and watery, and I have giddiness, I have scanty menstrual bleeding, painful menstrual bleeding, weight loss, hair fall, palpitation, dryness of skin, etc." So this is patient number A. Whereas patient number B walks to your clinic. She looks stout or moderately well built. The patient complains of white discharge. You ask what kind of white discharge it is. She tells it is kind of muco-gelatinous and very thick white discharge that is associated with visceragandha, that is associated with lot of smell. And you ask, what are the associated complaints? She tells her, "I have complete indigestion, I have sore belching, I have burning sensation after taking food, I have repeated urinary tract infection, etc." So she tells all the other symptoms, and you ask whether weight loss is there or you have lost certain amount of weight in a particular period of time. She tells, "No, I have only complaint of white discharge, that's all." What medicine will you choose for patient A and patient B? I see most of the doctors are choosing pattern medicines for this condition. I'm not judging, I'm just observing. They use pattern medicine, some kind of Leucol syrup, Leutab, of Cortical, Leucogel, Leucoplex, whatever starts with L. Most of the pattern medicines use. Now the problem with using most of the pattern medicine for both these patients is, most of the pattern medicine contains Kashaya, Tikta, Ravyas, like which is Lodra, Ashoka, or whatever available in Pushanuga Churnam or Musali, Kadiradi, etc. So what happens is, you give pattern drugs to both the patients. Patient number A will not get any result or will only get temporary result, and the patient will stop coming to you. Patient number B will get temporary result, but the disease will not get completely cured. So what is the problem while treating? Why such medicines do not act in that particular condition? Now let us deeply analyze patient A and patient B and what dosha they have. Patient A is having giddiness, pitta vata, white discharge, that is very thin, white and watery. Again, Pitta and Vata. Basic dosha of white discharge is Pitta. Now we have to find out which is associated with it, Pitta Kapha or Pitta Vata. Now, giddiness, Pitta Vata. White discharge, thin, white and watery, Pitta Vata. Menstrual, scanty menstrual bleeding, Pitta Vata. With pain, Vata. Weight loss, Pitta Vata. Kshaya, anemia, Pitta Vata. Pandu, Pitta Vata. Hair fall, Pitta Vata. Palpitations, everything is indicated that Pitta Vata. And loss of hunger, she don't feel so hungry, so she has little ama, Paitika ama in her. So this is a patient of completely Pitta Vata Vriddhi. Patient number B, she is stout, Kapha Pitta or Kapha. She has white discharge which is thick and mucus, Kapha Pitta. With lot of smell, then Pitta. Indigestion, Kapha. Sore belching, Kapha Pitta. Burning sensation, Pitta. So next patient number B is completely Kapha associated with Pitta, whereas patient number A is Pitta Vata, patient number B is Pitta Kapha. So what kind of medicine will you prescribe in both the conditions? So I am giving you all the gist of whatever available dosha combinations that can come to your clinic. Now if you choose both patients a single medicine, I promise you it will only act temporarily. Either number A, it won't act, number 2, it won't act temporarily, and the patient will stop coming to you. But how to give medicine in such a way that these patients get permanently cured, that I will explain. There are many causes of white discharge. The basically physiological cause, number 1 is physiological cause. White discharge because of physiological causes. What is physiological cause? If the patient is going to have menses in next 3 days, before the 3 days white discharge happens, that is normal, that is physiological, that happens for every woman. That is a physiological cause. Number 2, Kapha Pitta Vriddhi. I told you, the patient number B. Number 2, it is because of Kapha Pitta Vriddhi. Number 3 is Pitta Vata Vriddhi or Pandu or Kshaya, etc. So number 4 is miscellaneous reasons, either cervical erosion, cervical infection, some kind of pelvic inflammatory disease and cancer. All the complex other things comes in miscellaneous causes that we do not discuss in detail now. Now we will concentrate on 80% of the obvious reasons of white discharge and how to treat them.